High bilirubin levels, symptoms and treatment. The body produces bilirubin when it breaks down red blood cells and the liver helps excrete it. High bilirubin levels in adults can result from liver disease, pancreatitis, some cancers and other health problems. Elevated bilirubin can lead to jaundice, which causes yellowing of the skin and eyes. High bilirubin levels can occur in adults and newborns. In adults, jaundice is usually caused by a medical condition. This is called pathologic jaundice and is more severe. In 75% of jaundice cases in newborns, the cause is psychologic or non-pathologic. The skin normally becomes yellow once levels reach over 3 mg per deciliter. Any person who experiences yellowing of the skin or eyes should see a doctor. It may be a sign of a serious condition. This video defines bilirubin and examines the causes of elevated bilirubin levels in adults and newborns. It also looks at the symptoms and treatment options for high bilirubin levels. What is bilirubin? The breakdown of red blood cells in the body produces bilirubin. The red blood cells have a lifespan of around 120 days and they renew continually. Red blood cells contain hemoglobin, which helps transport oxygen around the body. The process of removing iron from each cell's hemoglobin helps the cells break down into bilirubin and other substances. Bilirubin is transported to the liver by albumin, a simple protein. Liver cells absorb bilirubin, which then undergoes several chemical processes. Once in the liver, bilirubin becomes conjugated. This means it is water soluble and the body can excrete it. The body ultimately expels bilirubin through stool. Bilirubin is brown and yellow, and it is this pigment that makes faces brown. Unconjugated bilirubin is toxic. Conjugated bilirubin is usually not because it can come out of the body as long as nothing interferes with its removal. High bilirubin levels in adults. High levels of bilirubin in the blood is known as hyperbilirubinemia. Elevated bilirubin levels can cause jaundice. Jaundice makes the skin and the whites of the eyes appear yellow due to the brown and yellow bilirubin in the blood. A doctor can usually detect a person's bilirubin levels through a blood test. In adults, the approximate normal range of bilirubin in the blood is less than 1 mg per deciliter. High bilirubin causes. Several conditions can cause high bilirubin levels before reaching the liver, after leaving the liver, or within the liver itself. Before reaching the liver, some conditions cause elevated bilirubin levels before it reaches the liver. This is the pre-hepatic or the pre-liver phase. The cause is hemolytic anemia and the reabsorption of internal pools of blood by the body. Hemolytic anemia occurs when too many red blood cells break down before their natural life cycle ends. In the liver, if the liver is not working as it should, it may be unable to make bilirubin water soluble. This may result in too much bilirubin building up in the liver. Causes for this include viruses such as hepatitis A, alcoholic liver disease, some medication doses including acetaminophen, autoimmune conditions where a disorder of the immune system causes it to attack the cells of the body rather than those that cause disease. After leaving the liver, once bilirubin has left the liver in the post-hepatic phase, its levels may be elevated because it is unable to leave the body. This may result from a blockage in one of the other organs that assist excretion, such as from gallstones in the gallbladder. Other causes may include inflammation or cancer of the gallbladder or pancreatitis. Gilbert's syndrome. Gilbert's syndrome is a mild form of high bilirubin. The levels go up and down because Gilbert's syndrome slows down the process of removing it from the body. The fluctuation is rarely enough to cause the skin to yellow, but some people may experience symptoms such as stomach pain or fatigue. Doctors estimate that about 1 in 3 people with Gilbert's syndrome do not experience any symptoms at all. In fact, doctors often discover the condition with a blood test performed for some other reasons. There is a gene linked to Gilbert's syndrome that shows family patterns of heredity. This gene codes for an enzyme that enables the liver to convert bilirubin to its conjugated form. The absence of this gene in Gilbert's syndrome means that this enzyme does not work. High bilirubin in newborns. Newborns with elevated levels of bilirubin have a condition that doctors call neonatal hyperbilirubinemia or jaundice in neonates. A doctor generally considers anything above these values to be elevated. You can see the chart at the screen. According to a 2023 overview of research, approximately 50% of full-term infants and 80% of preterm infants have visible jaundice in the first 2 to 4 days after birth if their serum bilirubin levels are at or above 5 milligrams per deciliter. In adults, bacteria in the gut break down the conjugated bilirubin to create a byproduct called urobilinogen, some of which is excreted by the kidneys as urobilin. The urobilin is also what gives urine its yellow color. In neonates, the liver takes several days to start adequately processing bilirubin. Neonatal jaundice occurs when the liver is not quite ready to process the bilirubin, and the accumulation in the blood causes certain tissues to look yellow. High bilirubin level symptoms. High levels of bilirubin in the blood can cause jaundice, which may cause symptoms such as yellowing of the skin, yellowing of the whites of the eyes, dark-colored urine, itchy skin, pale stool. Because an underlying condition such as liver disease or hemolytic anemia may cause high bilirubin levels, a person may also experience other symptoms including nausea, vomiting, stomach pain, bloating, unintentional weight loss, headaches, confusion, fatigue, drowsiness. Treatment. Treatment depends on the underlying cause of the high bilirubin. If the cause is known, a person might remove bilirubin through treatment or lifestyle changes, such as avoiding alcohol. Infants may need phototherapy, which helps the liver break down bilirubin using a special type of blue-green light to treat their high bilirubin levels. An exchange transfusion may also be necessary to remove the blood through a thin plastic tube and replace it with blood from a suitable donor.